My name is Dr. Brett Halbrand. I'm a cardiologist based at St. Paul's Hospital in Vancouver. And I primarily manage patients with cardiovascular disease. I've discovered that risk detection is very important in the treatment of patients, partly because many patients don't have symptoms or don't have any signs of obvious disease until it's sometimes a little too late. So early detection can make a profound difference. In this series, we'll explore how high-sensitivity troponin T, when used in the non-acute setting, can better risk stratify patients and also to plan the appropriate therapy for them. So let's begin with the bigger picture. Cardiovascular disease is the second leading cause of death in Canada, and more than 75,000 Canadians die each year from heart disease, which works out at more than 14 every hour. What makes this even more concerning is that often early cardiovascular risk goes unnoticed. Many of these individuals had no idea that they had cardiovascular disease before having an acute coronary syndrome or other major cardiovascular event. And so the focus in the last few years has shifted to early detection of these high-risk individuals so that we can intervene early and prevent problems before they begin. We rely on some tools like the Framingham Risk Calculator, but we've discovered that it has some limitations. It tends to underestimate the risk in younger individuals who have systemic inflammation, like for example those with rheumatoid arthritis or long COVID. And there are some ethnic populations who have an elevated risk, but it's not captured by the Framingham score. So that's why we need additional tools, especially in preventive care, and this is where the high-sensitivity troponin comes into play here. So high-sensitivity troponin T, or Hs Troponin T, has traditionally been used in acute cardiac care for diagnosing acute coronary syndromes. But what we've discovered is that low levels of troponin elevation, when used with the high-sensitivity test, can detect early cardiovascular damage long before hospitalization occurs with an acute coronary syndrome. An elevated high-sensitivity troponin T can help us identify early disease and prompt early interventions, such as statin therapy, more intensive blood pressure management, or lifestyle modifications such as diet and exercise.